It has been quite a year already for our state, and many around the Panhandle and across Texas are wondering, where do we go from here? Governor Greg Abbott joins us now live from Austin with a look ahead to the rest of the year and beyond. Good afternoon, Governor. A lot to talk about. You attended the memorial yesterday in Houston for George Floyd. You spoke with his family. What did you take away from that conversation that will help you frame the state's plan for change going forward?
I had this great opportunity to spend a lot of quality time with his family, getting to really know them. And they are people who truly are people of God, but also care dearly about the loss of George Floyd. They mourn yesterday and they mourn today, but they are prepared to work with me, to work with the state of Texas, to work across the entire country to ensure that his life has not been lost in vain. They want to ensure that remedies will be enacted into place to ensure that this tragedy is never repeated again anywhere in the country. They want to work to make sure that they are at the forefront of the voices that are leading the efforts to respond to any divide that we have among races in this nation. They want to make sure that it's victims like themselves, as opposed to politicians, who will be leading this effort. They are very genuine people, very committed to very positive changes in Texas, and I look forward to working with them.
You touched on my next question briefly there, because one of the criticisms of previous efforts to reform law enforcement is that those plans were made by people within the system that's broken. They might have a vested interest in keeping change at a minimum. Can you give us any more specifics as to who you'll actually be listening to put this program together?
First, I will be listening to people like George Floyd's family, as well as other victims and families of victims. Second, I've already begun the process of listening to legislators, and that process will continue tomorrow. And then third, we need to listen to all stakeholders. It could be people of communities, it could be law enforcement, which is very important to hear from. It could be experts in the field, but definitely people who have been victimized by, let's say, police abuses, people who have lost loved ones because of excessive force being used. There's so many different people to hear from, and that's why this will be a very important issue as we come up upon the next legislative session.
The phrase defund the police has been a rallying cry in some cities. On the state level, is that something you could consider, not entirely eliminating law enforcement, of course, but rethinking that budget as if it were a brand new department even?
Let's be clear, we don't need fewer police. We need more police. We need better funded police. We will have chaos in our communities without an effective law enforcement. We do, however, need to ensure that our law enforcement, they will have the tools and the strategies and the training to ensure they go about law enforcement in the right way. Part of law enforcement means to make sure they will be able to de-escalate criminals. They will be able to arrest criminals who have committed crimes and arrest them in safe ways. But also, remember, they are called peace officers for a reason. Part of their job is to protect communities, but part of it is to ensure that they instill that sense of peace in our communities, including all sectors and members, all the great diversity in our communities. With the appropriate training, I know that they are committed to achieving that goal.
Governor, looking beyond this upcoming session 7 months out, is it unrealistic to think that all the issues surrounding racism, not just within law enforcement, but across society, business practices, school curriculum, that kind of thing, can someday get the same political attention year in, year out as education does, as healthcare does, as property tax does? Do we need a cabinet level type position maybe that's tasked with keeping racism issues prominent?
You know, this seems to be a galvanizing moment where everybody is realizing the necessity that more work be put in to build the bridges, to decrease and de-escalate the division that is seen among races, and to make sure that we do all we can to eliminate racism both in the state and in this country. And as a result, I think that you will see going forward a deeper commitment to achieving those goals.
I want to pivot away to another topic that's still out there, the COVID pandemic. It does seem to be flattening a little bit, definitely not going away though. Hospitalization numbers in Texas at a new high. I read over 1,900. Possible exposure during the protest recently might drive those numbers higher over the next few days or weeks. What are your concerns there that might possibly lead to a pause in the reopening plan or even rolling it back?
So we see differing results in different regions. In your newscast, you articulated earlier how the numbers are looking far better in the Amarillo area. Hospitalizations are going down. The number of people testing positive is going down. And so all the numbers are moving in the right direction in Amarillo as well as in the Panhandle. In some of the large urban areas like Houston and Dallas, for example, we're seeing more people going to hospitals and more people testing positive, and we are looking into the details to find out exactly why. It could be possible, knowing that these protests that had thousands upon thousands of people gathered closely together would have provided an easy way to transmit COVID-19. We will soon find out if that is one of the reasons why there are more people hospitalized, why there are more people testing positive in those regions.
Last question. Your office announced that a new shipment of remdesivir is coming to Amarillo. The White House says that supply nationally could run out by the end of June. They're trying to secure more. Is there anything the state can do to search for its own supply, or is this something that must be handled on the federal level?
This comes through the federal government, through the Health and Human Services Department for the United States government. But we continue to receive allotments, especially for the Amarillo area, to ensure that the people who have been infected and who are hospitalized there will be able to receive this treatment. Understand this, however, and that is over the coming months, maybe as soon as July, it could be August or September, there will be additional medications that should come available to allow even more comprehensive treatment for those who have tested positive for COVID-19.
Governor Abbott, thank you for joining us. We hope to talk to you again in Austin. We appreciate your time today.
I look forward to it. Thank you so much.
When we come back here,